I'm Maria. I'm a student paramedic.
Hello.
How are you?
I'm good, thanks.
Good. I've been told to do a respiratory assessment on you. So firstly, I'm just gonna confirm your name and date of birth, please.
My name's Kate and my date of birth is 10/2/73.
Perfect. All right. So have you had a respiratory assessment done before?
No, I haven't.
Okay. Well, I'll talk you through it. So first of all, we're going to have you in a 45-degree position, which we've got. Ideally, we'd have a bare chest, but because we're videoing, we won't do that today. And also, are you in any pain?
No.
Okay.
Pain.
All right. So what I'm going to do is I'm going to have a look at your body, and then I'm going to have a listen. I'm going to have a bit of a feel, and I'm going to percuss as well. So I'll talk you through it as I go.
Great.
You comfortable with that?
Yes.
Awesome.
Yes.
All right. I'm just gonna step back from my scene, and I'm gonna talk about my approach. So on approaching a scene, I'll be looking at the bedside environment. I'll be looking for breathing apparatus, medications, anything that might indicate the patient is sick. Then I'm going to look at the patient's position. So Kate is in a nice position, seems relaxed, as opposed to a tripod position or in some uncomfortable position. I'm going to look at Kate's work of breathing, which seems regular and normal. I'm going to listen for any audible sounds, audible wheezes or crackles. I'm going to look at her skin colour, see that she's nicely coloured, not pale or clammy skin, and I'm going to assess for shortness of breath. So Kate was talking to me in full sentences, which is a good sign. Alright, next I'm going to inspect. So now I'm going to come up to my patient and I'm going to start my inspection. So first I'm going to start with your head. If I could get you just to pull down your eyelid for me. Yep. And I'm checking for conjunctival pallor. Alright, and let go. And now I'm just going to get you to shut your eyes and open them. I'm just checking that the pupils react to light. And now I'm just checking the mouth. I'm looking for central cyanosis. So could I please get you to open your mouth, stick out your tongue and lift it up so I can see the bottom? Perfect. So Kate's tongue is nice and pink, not blue. Alright, next I'm going to look for jugular venous distension. So if I could just get you to look that way. And I'm just looking at Kate's jugular vein, and I'd be noticing if it's distended or not. But it's not, it's looking good. So thank you, you can turn back. Alright, then I'm going to assess the chest. So I'm going to look for equal chest rise and fall. I'm going to look for any mottled skin or thickened skin. And I'm going to look for any scars. And I'm going to ask Kate, have you had any surgery on your chest before?
No.
No? Any chest worries? Any problems with your chest?
No. None.
Cool. So, and I can't see, there's no visible scars, and the skin looks good and clear. So next I'm going to check your hands. So if I get your hands out for me, awesome. So first I'm going to feel for temperature of both hands. Everything I do is going to be both to make sure that it's equal. Alright, temperature's good, and then I'm going to feel for your pulse on both hands, checking that they match. Same time I'm going to be watching Kate's rest rate. We want it between 12 and 20, and pulse between 60 and 80 for a normal adult, and Kate seems very good. Alright, I'm just going to have a look. I'm just going to have a look at cap refill, so keep it like that. Just going to have a look for cap refill. Should be between 2 to 3 seconds. Perfect. And can you turn your hands over for me? I'm going to look for tarred skin, which could indicate smoking. Kate, are you a smoker?
No.
Okay, cool. And hands back over for me, and I'm just looking for any peripheral cyanosis. So Kate's hands look quite nice and a normal colour. Awesome, you pop them down for me. Alright, next I'm going to look at the skin of the whole body. I'm looking for mottled skin, whether she's sweating profusely or finding it, the skin looks like she's in trouble. Kate's skin looks nice and dry and a good colour. It's not white or pale or blue. And also I'm just going to get you to sit up for me, Kate, so I can do the same on the back. So I'm just looking for scars on the back. I'm looking for the skin colour, the back of the skin. I'm looking for equal chest rise on the back as well. Awesome, you can lie back down. Okay, next I'm going to palpate. So that just means that I'm just going to press into areas and see feeling for any abnormalities, like a bump or a lump or air or any abnormal noises maybe. So, so first I'm going to start off. I'm just going to check your tracheal position. So I'm just looking for equal positioning. Pressing in here, it's a bit uncomfortable, but that's all. It's okay. Don't worry. All right. That seemed fine. Then I'm going to feel for the apex beat. So it's going to be the 5th intercostal. So 1, 2. So it's just going to be in mid clavicular. So if I could just get you to lift up that for me. I'm just going to, good, nice and strong, perfect. And then I'm going to assess for chest rise. So I'm going to do this by gripping around your chest, like this. And my thumbs are going to be touching. I'm going to ask you to take a big breath in and out. And I'm watching to see if my thumbs move regularly apart, equally apart. If there isn't, that could indicate that there was a lung deflation. If I could get you to sit forward, I'm going to do the same thing on the back. So just in for me and out. I'm just assessing, same thing. Alright, you can lie down. And lastly, I'm just going to feel for your carotid pulse. At the same time, I'm going to be measuring the distance from the collarbone to the cricoid cartilage. It should be about 3 to 4 fingers. We'd be wanting to notice if it was any less than that. Also, and I'm going to feel for the pulse on both sides. Check that it's present. Perfect. Very good. Okay, thank you. Next, I'm going to auscultate. So that just means I'm going to have a listen. I'm listening for abnormal lung sounds. So I'm going to listen for the quality. If it's vesicular, that's normal. If there's a lack of lung sounds, that could be a worry. If there's a wheeze, or coarse crackles or fine crackles. I'm also going to be listening to the volume. So we want nice loud lungs, or like decent audible lung sounds. Quiet breath sounds could indicate decreased air entry. So I'm going to start, I'm going to do that. And then I'm going to get you to breathe deep breaths in and out on each time I move my stethoscope, and out through your mouth, if that's okay. All right. So just in for here. Big breath through your mouth. And here. Perfect. I'm just going to lift up your top. And here. Lovely. Alright, and the same on this side. Yeah. Thank you, and I'm just going to ask you to sit up for me, and we'll repeat that on the back. So, big breath, in and out. Deep breath in and out. And last one, deep breath in and out. Now while you're sitting up, I'm just going to do the same thing, but instead of breathing in and out, can I get you to say 99 for me? I'm listening for vocal resonance. So there we are.
99.
Yep.
99.
Yep.
99.
Yep.
99.
Cool.
99. 99. 99. 99.
Thank you very much. Okay, you can lie back down. And the last thing I'm going to do is I'm going to percuss. So with percussion, I'm looking for resonancy. That's good. That's normal. Hyperresonancy could be pneumothorax or air-filled cavity, and a dull or lack of resonancy could mean fluid. So I'm going to do that supracricoid, infracricoid on her chest and axilla. So it's the middle finger of my non-dominant hand. I'm just going to come around, make it a bit more comfortable. lovely. And go around the other side. With this, we're trying not to tap on the actual rib bones, but between them. And just under your arm. Ideally, as I said, we'd have the shirt off for this. But cool. And I'm just going to repeat that on your back. So. Okay, you can lie back down. Everything was resonating nicely. So just a quick summary. On inspection, on approach to Kate, there was no odd apparatus around, no medications. Kate seemed very comfortable and not distressed. And then on inspection, eyes were good. There was lots of blood flow. The pupils dilated nicely. There was no central cyanosis. And there was no jugular venous distension. Chest looked good, looked very healthy. Hands were good, fine, healthy, non-smoker. Skin was a nice colour, it was dry and well perforated. And the back was exactly the same. Palpating, I didn't feel any abnormal protrusions. Auscultating, the quality was vesicular quality, and I could hear it quite nicely, and good volume, and vocal resonance was perfect. I was hearing resonance as she was saying her 99s. Percussion was all nice and normal, resonant, didn't feel any dull or hyper-resonant spots. So I wouldn't recommend any further treatments for you, Kate, but in the case that there were abnormal findings, we could have put on some oxygen sats and checked that, such as cyanotic fingernails. We could have supplied Kate with supplementary oxygen if her sats were below an ideal range. If Kate showed any signs of asthma, so an expiratory wheeze, we could have done a peak flow assessment. I'd recommend a chest x-ray if there were any hyperresonant or dull sounds, and any suspected COPD or abnormal SATs readings, we could have got an arterial blood gas sample, and if it was indicated, we could have also got a cardiovascular exam happening for Kate. But today seems fine. Thank you so much for being here.
Oh, great. Thank you.
No worries. See you later.
Bye.